Hello, good afternoon, ladies and gentlemen. I'm sure you can do better. Good afternoon, ladies and gentlemen. Really, really good to see you. Let me tell you, the train was fantastic on the way from London. I was delighted. Many of you were watching the show this morning saying, how is David going to get here? Well, I made it, so I am delighted by that. Also, I am already in trouble. A number of gentlemen have come up to me and said, you are spending more time in my bedroom with my wife than I am. Let's move on to some really serious issues. I want to talk about a subject really close to my heart, and that, of course, is the NHS. And I want to talk about my prescription for the nation. How do we reform the NHS? And I want to start by posing a question to you. What do you think actually defines an advanced society? Well, I think the mark of an advanced society is when people live with organisation and comfort, where they have high levels of health, of science, of industry, with culture and government. Now, fundamental to this quest is to ensure that we have a robust, world-class healthcare system that doesn't discriminate. It doesn't discriminate on the basis of class, of race, of gender, sexuality, or income. And that is why the inception of the NHS in 1948 under Bevan was really so trailblazing. It was so groundbreaking. And that is why the NHS remains a core British value. I can tell you this, it elucidates very strong emotions indeed. It is part of our national DNA. Now, to understand where we are and what reforms need to be effected, I think we actually have to travel back to the very start, to the conception and the founding principles of the NHS. Prior to the formation of the NHS, there had been some form of state-funded provision in England for some 400 years. Now, initially, the poor, the infirm, and the elderly received care from religious orders, particularly the monasteries. Now, after they were abolished, the Poor Law came in 1601, brought with it almshouses. Later on, the workhouses provided shelter for the poor, for the orphans, and for the elderly. Where it gets really interesting is by the late part of the 19th century, differing models of healthcare began to emerge in this country, including hospitals for mental illness, for infectious diseases. There were also voluntary hospitals run by boards of governors. Alongside this, primary and community care then began to emerge separately from those hospitals. But right at the beginning, there was no cohesive structure, and the whole thing was incredibly disjointed. The first step in creating a nationalised health service was in 1938, prior to the war. What happened then was the Emergency Medical Services Act was passed. That required hospitals to register, and for the very first time, these were run centrally. Now, the culmination of all of this was the Beveridge Report, and that was in 1942. That led to the inception of the NHS, and let's just be really clear here what the NHS is and what it was set up to do. It was an integrated, state-funded service to guarantee, and I quote, basic levels of personal and social security. It had a defining characteristic. It had to be free at the point of need. And for the very first time, the government assumed responsibility for the provision of a comprehensive service for the whole population. What is very striking, there was a leaflet sent to every single home in this country. And the government promised that the new NHS will provide you with all medical, dental, and nursing care. Everyone, whether you're rich, whether you're poor, you can use it, or you can use any part of it. So let's now look at the differences between then and now. Clearly, there are massive differences between then and now. Let me illustrate that. In 1948, there were just 43 million people in this country. There are now 67 million people in this country. People now live, on average, at least 10 years longer than they did in 1948. In 1948, there were nearly 500,000 hospital beds. 500,000 hospital beds for that population of 43 million. Today, how many hospital beds are there? Not 500,000? 300,000? Nope. 200,000? No. There are only 167,000 hospital beds in this country, even though the population has gone up by 25 million people. In 1948, the total budget for the entirety of the NHS was £248 million. Today, the total budget is £170 billion. We now spend 11.7% of our GDP on health in the UK per year. So it is not about money. And all of these bleeding heart politicians will tell you the solution is more money. The solution is not more money. So let's just look at the state of the NHS. What does the NHS actually look like in 2024? So despite having record levels of funding, the health service, and I think this is fair to say, is in terminal decline. Let's start with doctors. There are only 123,000 doctors in this country. We are short of 12,000 doctors. We only have 27,000 full-time GPs. 25% of those GPs will leave in the next few years. In 6 years' time, we are going to lose another 8,800 GPs. On top of that, 1,200 GP practices have now closed. At the same time as all of this, of course, the NHS, in its infinite wisdom, has still managed to spend £40 million on diversity-related roles. But the real test for me, actually, is not that. It's waiting lists, something dear to your hearts. In 1948, there were 492,000 people on the waiting list. How many people do you think are on the waiting list now? 20 million people are waiting for treatment on waiting lists in this country. That is nearly a third of the population. And you don't know that. And the reason you don't know that is because the official list is 7.71 million. So what happens is there is a hidden waiting list, and they won't tell you about that. So you've got your 7.7 million here, but another 11.3 million people are waiting for onward care. They've been seen, but they haven't actually been dealt with. They are then hidden. Now, you and I know the waits are intolerable. 15 million appointments took place later than 28 days after being booked. Let's turn to doctors' strikes, and if you watch my show on Talk TV, you will know I have been fairly strong about the doctors' strike. I think the impact of the strikes has been nothing short of catastrophic. The strikes have cost us, the taxpayer, £3 billion. As a result, 100,000 cancer patients are now diagnosed late. 29,000 people waited more than 3 months for an MRI or for a CT. 1.2, now 1.4 million operations and appointments have been cancelled. 1.4 million. Cancer operations, 7,000 delayed. For every 4 weeks that we have a delay, your risk of death goes up 10%. Let me bring this back to a human level. Last week, a 67-year-old woman in Leicestershire died. She was trying to get through to her GP surgery 3 hours after she called an ambulance. The ambulance was not sent. When she phoned 999, they said, "What is wrong with you?" She said, "I cannot breathe." The ambulance did not come. She couldn't get through to the GP. She died 3 hours later, still clutching her phone, trying to get medical help. I find it really hard to read those kind of stories. But we need to stop fooling ourselves, because we keep saying the NHS is providing world-class care and it's the envy of the world. Guess what? It isn't by either metric. So look, we have to do something. We have to have a bold, ambitious plan. What do we do? How do we turn this around? And that's where we come in, because we have to have this bold, ambitious plan for the NHS. And I believe, as Richard does, Reform UK is the only political party to openly admit that the NHS is not fit for purpose. You will hear the politicians, the Tories, the Labour Party, they believe the only way out of this mess is to throw more money at an unfit, unwieldy, bust system. It's not the answer. We need to be bold, we need to be radical, we need to have ambitious targets, but we have to ensure we remain true to the founding principles of the NHS. I said them right at the beginning. That care must be free at the point of delivery. And this is the big news. We, as a party, have identified how to fund and to invest £17 billion more per year into the NHS. That is an extra 10% into UK healthcare. But it's not via the wasteful and often incompetent NHS managerial system. Our investment gets that money to frontline staff and to independent healthcare sector. And that consists of not-for-profit groups like Bupa, like Nuffield Health, also private operators. I bet many of you didn't know that Bupa and Nuffield Health were not-for-profit. So our investment and reforming plans will make healthcare in the UK fit for the 21st century and will enhance Bevan's original achievements, whilst ensuring the provision of healthcare remains free at the point of delivery. We have a really bold target, and our aim is really simple, and we're not ashamed of it. We believe, and we aim, to deliver 0 waiting lists within 2 years. It's a big, bold ambition. And we can do that with a very clear initial 5-point plan. The first of those points: we want to incentivise doctors and nurses. I feel very strongly about this. We want doctors and nurses to feel valued. They've got to feel loved. We want to incentivise them to remain in the NHS. So, under our policy, all frontline NHS and social care staff will pay 0 basic rate tax for 3 years. What does that mean in real life? Well, for a standard nurse on the front line, this is basically a net pay increase of £4,300. That is a 13% pay uplift, and that is if you use existing tax thresholds. Or, based on our new tax thresholds, which Richard, I'm sure, has spoken about this morning, it's £2,800 uplift based on those new tax thresholds. This will immediately actually do a number of things. It will retain existing staff, which we are currently losing. It will make them feel valued. It will also make them feel wanted. One other thing, it will actually attract some trained staff back onto the front line, caring for patients. I think crucially what it does is it restores morale. And that is something that is sadly lacking in our workforce. It will also dramatically reduce the ridiculous, extraordinary sums being spent on agency staff. The second point to the plan, we have to incentivise students. Reform UK has consistently been calling on the government to train more doctors. I don't know if you know this. The very people who blocked the number of doctors being trained were the British Medical Association, the ones who are responsible for these strikes. It was capped at 7,500 training places a year. We have been going on and on and on about this, and the government has finally listened. They have doubled that to 15,000 places every year and not before time. But it's not enough. We need to go further. We need to end training caps completely. One other thing, we need to increase accessibility for those wishing to study medicine, especially from lower socio-economic groups. I think that group of people actually understand real hardship. They understand what it's like to work, to get to where you are. They understand what it's like to be poor in Britain. Shockingly, 25% of newly qualified doctors leave the service after 1 year. 25%. And they leave for lots of reasons, but they leave with massive student debt. Massive student debt. 50, 60, 70, 80, 100,000 pounds of debt. So here's what we will do. Reform will write off all the student debt for all doctors, all nurses, all medical staff, pro rata per year over 10 years. So, if you stay in the NHS for 10 years, after you qualify, we will write off your entire student debt. Under these plans, also remember, and this is crucial, under our student loan plans, there is no interest either to pay on that student debt. Now we need to tackle the consultants. We have to incentivise consultants to stay in the system. The current pension rules are insane. They are actively encouraging senior consultants to leave the service. At the moment, they have a lifetime pension cap. If you exceed that lifetime pension cap, then you pay tax. So, as a result, when they reach that level, many of my friends have done it, they retire. It is not worth them continuing in the NHS. And, as a result, 70% of consultant surgeons now do fewer hours as a result. So we will be bold. We will remove that lifetime pension cap. Our fourth policy, we want to incentivise providers. There isn't enough capacity in the system. You and I know that all too well. We need to dramatically ramp up the amount of capacity in the system. And in the short term, what does that mean? Well, over the next couple of years, there has to be a huge endeavour by the NHS to buy millions of extra appointments and operations from the independent sector. As I said right at the beginning, this sector is made up of charitable providers, also private providers. As a result of this, they will rapidly step up to the plate, increase capacity, and what they'll do is they will work longer days, they will implement weekend working, and because there is more money in the system, that will mean we can actually blossom and grow the capacity in the system. Now, to achieve this, we also need logistical assistance from specialists in procurement to manage and reduce waiting lists. And here's the key, the reason this works. Money always follows the patient. I outlined this last year. So, the pledge to patients is simple. If you can't see a GP in 3 days, you are then entitled to use a private GP and it will be paid for by the NHS. If you cannot see a specialist within 3 weeks, you will see a private specialist. Again, that money, that appointment will be paid for by the NHS. And if you can't have your operation within 3 months, again, you can go privately and the NHS will settle your bill. It's a radical plan. It's a radical plan, but it will do 2 things. Firstly, it ensures that we slash waiting lists and we improve care for patients. Secondly, it will also cause private healthcare to mushroom, and market forces will mean that the private providers will be incentivised to provide quality care at a competitive price. Once waiting lists are then brought under control, we will keep capacity in the system using a voucher system to maintain capacity and performance. The final spoke to this is I really want patients to be incentivised. If you, as a family, want to be proactive and protect yourself and your family by taking out private healthcare, you should not be penalised, which is what is currently happening. Not only should you not be penalised, actually you should be applauded because you are relieving pressure on the NHS. And that is why Reform UK will give tax relief of 20% on all private healthcare and all insurance. And it's simple, isn't it? The more the pressure eases on the NHS via this incentive, the faster, the better care that everyone receives. And competition is key. It drives up standards and it drives down costs. I was talking to someone earlier, talking about the difference between throughput in an NHS hospital and in a private hospital. They are poles apart. You are seen faster and quicker. It is much more efficient in a private hospital. Why? Because time is money. In the NHS, they do things at a much slower rate. Now, alongside this initial 5-point plan, there are other pressing issues to address, such as cutting waste, bureaucracy, getting rid of a whole load of managers. I'll tell you something else. We, as a party, came up with Pharmacy First. That has now been stolen by the Tories. We lead and they follow us. I want to be really clear here. This is not about destroying the NHS. This is about improving and future-proofing the NHS while staying true to Bevan's original groundbreaking idea. That is, and I will reiterate it, care continues to remain free at the point of need. This is about finally providing world-class healthcare where zero waiting lists are the norm and not the exception. Our healthcare plan, quite simply, protects the NHS by taking huge pressure off it permanently. Thank you very much.